Hello, everyone. Now, if you ask someone, what is one of the first things that you notice about a person? Their smile is probably at the top of the list for a lot of people, right? So having a healthy smile and happy smile at any age is very important. That is why Dr. Kurt Kaser with OrthoPros is here today to help us. And I think you probably, in your profession, think the same thing. A smile means a world of a difference.
Yeah, and they've actually done a lot of studies on what people notice the most, like first impressions on people, and smiles are always at the top, if not the first thing. And I think it's just a society now too. That's what people see, and the smile when it's there and looks nice, and that confidence that comes with it. Yeah.
Confidence, that's what. And I know we're kind of talking about first impressions and the confidence that it gives you, but why in general is oral health so important?
Yeah, and it really starts with just maintaining good overall health for overall health of the body, right? And when people have periodontal disease or they're not taking care of the teeth the way they should, it's basically an infection that's in the body that's not being addressed. And so that will slowly wear down. It'll wear down the immune system. They've done a lot of studies that link it to cardiovascular disease. And so maintaining good oral health is just a huge part of maintaining overall health.
And I think a lot of people don't realize that it can start affecting other parts of your body, especially if it goes too long untreated, just like anything else that goes on in your body. So what are maybe some of the common things that you see that people come in, and some common things that maybe were avoidable?
Yeah, and I think the first thing is just basically getting a cleaning every 6 months for most people. Some people need it every 3 to 4 months if plaque and tartar build up more. But I think just the first thing is just maintaining that. I think most people can manage that and keep it healthy with consistently. You're going to get some cavities and fillings as you get older, right? And that's usually the main thing that we see is cavities, breakdown. But what we really see is people who haven't been to see the dentist for a long time, that it's now at an advanced stage, and then it's harder to manage at that point.
And I'm going to say this even though you're sitting right next to me. A lot of people are a little intimidated or maybe have a little bit of fear. Do you have something that you normally tell people to kind of loosen them up, make them feel better about the situation?
Yeah, I think it's more just trying to make them comfortable in the office and hoping that they trust us and our staff that we're going to do the right thing and we're going to listen to what their needs are as well too. Because it can be a very intimidating procedure in general, and a lot of people are fearful of it a lot of times because it can become painful when it's left untreated, right? And that's typically when people see the dentist, whereas if we can get people in for regular cleanings and maintain that, it's usually much more manageable, and that's when people really start to become comfortable with the office.
Well, let me say that the staff over there, and every time we get to sit down, I feel super comfortable, even in this setting, and I feel like you guys do an awesome job of doing that. Let's kind of dive into a couple of things, because I said at the very beginning, a healthy, happy smile is something we should be thinking about at all ages. So I want to kind of hit parents. We think, okay, we're going to make our appointment. We're going to go once a month, here, there, whatever. But they also have to think about their children. And this is at any age, right?
Yes, yeah. And typically pediatric dentists, so they're the ones that are dealing with smaller children and younger children. Typically it's when the first teeth start to erupt in that they want to be seen. And for orthodontics specifically, it's typically 7 or 8 when the permanent teeth are coming in, because we're not looking so much at cavities and fillings, which the dental side does. We're looking at growth and development of the teeth and the jaws. But 2 years old typically, or when those first teeth really start coming in that set of teeth, that's when we want to get an evaluation and really monitor. We were talking, if from the orthodontic side, we'll do consultations which are free in our office from 7 years old until 11 or 12 if they're not ready for treatment yet.
Right.
And that's how most people fall into that. We only treat about 5 to 10% of kids in that age range. Most of them, 85, 90, 95%, we're monitoring and just managing things as we go.
So that's a great thing to point out. So I want to make sure everybody understood what we were saying. Don't wait for the teeth to come in and then you're like, oh, maybe they came in crooked. Maybe we need to get this fixed. If you have a free consultation along the way, you can kind of monitor as it's happening. Why not be ahead of the game? And we were also talking about something that a lot of people don't know about, and also when we're talking about children, is something called sealants for the kids. And you said this is like world's difference for children.
Yeah, and to me, it's sort of the best dental procedure in terms of how effective it is and the cost of it. It's very minimal, but to be able to get a sealant on molars on young kids when the teeth are first erupting in the molars. That really saves a lot of problems down the road in terms of keeping them clean and preventing cavities. It's a wonderful procedure. We've started to incorporate it with all our orthodontic treatment, that we've brought a hygienist into the office to place sealants and make that easy for the patient, and to maintain good oral health, and to be able to do cleanings in the office so that it's as convenient as we can for people. But that single sealant procedure is what we think is the best one.
So doctor, I want to make sure, out of everything that we've talked about, the one thing I'm going to take about is prevention.
Yes.
A lot of what we just talked about, whether it's, consultations to watch as the teeth are coming in, the sealants, making sure you get your cleaning, prevention is going to help you so much later on down the road.
Yes.
And you do all of that.
Yes.
So I'm going to make sure that they know how to get a hold of you guys and start that. Today is the day. We're going to get some people in. They're going to be happy and healthy.
Perfect. We'd love to see them.
You guys do a great job. For a healthy and happy smile, make an appointment with Dr. Kacer by calling 290-8787. You can also visit orthoprostucson.com for more information on anything that we discussed today.